If you present to the orthodontist a little bit later in life as an adult and your concern is crowding, how do you solve the crowding in a stable way without creating more problems? Well, one way we're dealing with this nowadays is called Interproximal Reduction or aortic stripping, ARS. This is for more aggressive cases where you might think of extracting, but you're trying not to. Hello, this is Dr. Corina Radu, owner of Premier Orthodontics and Dental Specialists. The topic for today is the dreaded interproximal reduction. I hear this all the time. What are you talking about? You're gonna shave my teeth? Absolutely right. I had that procedure done to my own teeth and it helped a lot. What is this procedure? Basically is taking a small amount of enamel. It's, by the way, irreversible. From in between the teeth and using that space that is given from the reduction of the enamel to unravel the crowding. When the teeth are on top of each other, overlapping, like in this particular case, this is a 3D print of a patient that was scanned for clear aligners. If you see in the front, there is a lot of overlapping to the point where one of the teeth had moved in. Usually they move in and they start going up, and it's getting worse in time. This patient doesn't like it, so we're talking about aligning them all. But where are the teeth gonna go? We already have some issues, as we see, and a lot of the adult patients present with thin gums and gum recession. So one way to deal with this, going back again to what we were talking, is to actually create a little bit of clearance between the teeth. It is done with either discs like that. They're called interproximal discs. Obviously professionally done. We know how to do it. We don't want to bother your cheek or your lip. Or you can use just very thin pieces of metal that have aluminum oxide particles on it. It's the equivalent of a filing. Little by little, putting it in between the teeth, we can take a little bit of space and bring the other teeth back into that space in such way that if we do it over 8 or 10 teeth, you can gain 4 or 5 millimeters of space to avoid extractions. The teeth becomes a surface, and now it is harder for the teeth to relapse when you have these surfaces in contact with each other, so it creates a lot more stability. I was treated like that. My bottom teeth were crowded and I chose to have interproximal reduction. I was already a trained dentist by then. I knew what that meant and I'm okay with it. I did not want a tooth extracted. It helps a lot preventing gum recession and periodontal issues in older patients. It's also a great procedure when you have teeth that are very, very triangular and they're overlapping before treatment. Once you start unraveling the crowding, the gum tissue will start moving down. It creates a black triangle that nobody likes to see. And when you reshape those teeth and close the interproximal surfaces, there is less likelihood of you packing seeds. For example, when you eat bagels, they all get stuck in that little triangle close to the gum line. And it looks nicer when you reshape the teeth. It's, again, like a manicure for the teeth. It helps a ton. This chart shows where we need to open contact between what teeth, at what stages, and how much, basically, between certain teeth. It's done very safely, very easily. You don't need anesthesia for that. One more time, I don't need to numb you up for that. It doesn't hurt. It's a little annoying, but that's about it. It's nothing worse than getting a nice manicure. What you need to move the teeth is basically putting pressure with something, whether it is braces or clear aligners. And then you need that pressure to act for a certain period of time. If it's there for only a couple of hours, the movement will not happen. So you create the space, you apply the pressure, and you need time. These are the 3 ingredients that are needed for moving the teeth. you can take your children to the orthodontist a little bit earlier in life. If you were a crowded case and you needed extractions or you needed this procedure, the interproximal reduction, then maybe your children will inherit your genetics. So an early consultation will go a long way. So with this being said, I'm going to conclude this segment about interproximal reduction and the need for space maintainers and having your children evaluated around the age of 8 to reduce the likelihood of needing interproximal reduction and extractions.